Good morning. In St. Louis, we are so fortunate to have some of the best healthcare and research facilities in the country. During this pandemic, our region has benefited greatly from talented doctors, scientists, researchers, and others focused on keeping us safe, not only with treatment, but studying the virus so we know more about its spread and its long-term impact on our health. Our Department of Public Health commissioned a study launched by the Institute of Public Health at Washington University on the spread of the disease. It found that at least 1 out of every 100 St. Louis County adult residents had an active COVID-19 infection earlier this fall, while about 5 out of every 100 adults had contracted the disease at some point earlier, according to test results of a representative sample of county residents. Results of the COVID-19 St. Louis County survey amplified concerns from experts about the high risk of further rapid spread of the disease in the county, especially given the explosion of COVID-19 cases since the testing was conducted. The testing measured the active COVID-19 infections based on nasal swab tests. Past infections were determined by antibody blood tests. The findings suggested that over the course of the testing period, 1.2% of St. Louis County adult residents and some 9,500 total had an active COVID-19 infection at any given point, and 5% of adult residents, or about 39,000, had COVID-19 antibodies, indicating a past infection. Given that the testing occurred before the most recent surge of cases, current prevalence is certainly much higher. These findings are the first representative assessment of the burden of this disease in St. Louis County and provide another indication that the region is still highly vulnerable to the COVID-19 pandemic. Since antibodies likely confer immunity, the survey indicates that about 94% of St. Louis County's 1 million residents were still susceptible to the virus in mid-October. Public health leaders in the region agreed that proven preventative measures such as wearing masks, staying at least 6 feet apart from others, and avoiding crowds and washing hands are essential in slowing the dramatic rise in cases. Working with the county, the Institute for Public Health teamed with other local public health and healthcare providers to also conduct a phone survey of representative St. Louis County residents. Participants were offered a free COVID-19 test at locations across the county. They could choose to receive diagnostic testing to detect active COVID-19 infection or antibody testing to detect previous infection. Transportation to and from the testing sites was provided free of charge to those who needed it. Over the course of the survey, more than 1,300 county residents received a diagnostic test through a PCR nasal swab or an antibody test through a blood test. More than 3,300 residents also completed a questionnaire to gauge how the pandemic had affected their lives. While detailed results of the questionnaire are forthcoming, initial analysis shows that a quarter of those surveyed had experienced wage reduction or job loss due to COVID-19. This highlights the pandemic's wide-ranging impact. In addition to the estimates of overall prevalence, the survey found that Black residents were more than twice as likely to have had COVID-19 as white residents, 8.3% versus 3.4%, based on results of the nasal swab tests and the blood antibody tests. This disparity is also apparent in higher COVID-19 death rates among Black residents compared to white residents. St. Louis County has directed CARES Act funding specifically to the hardest hit communities, mostly in North St. Louis County, and will continue to strive towards health equity in the ongoing pandemic response efforts. This is a commitment I made when we first received the CARES Act grant. This survey gives us critical information for the understanding of the impact of COVID-19 in the community in making decisions on how to shape our response to best help our residents. We are grateful to have these survey results to help guide us in our evidence-based approach to fighting the pandemic and ensuring our public health policies address these inequities. The St. Louis County Department of Public Health allocated $1.99 million of its share of Federal CARES Act funding to pay for the survey. The department ultimately will use the project data and results to help inform decisions about public health and healthcare delivery during the pandemic and possible public health emergencies in the future. The Institute for Public Health at Washington University had managed this project. Collaborators for the COVID-19 testing included BJC Healthcare, SSM Health, Mercy, and the St. Louis County Department of Public Health. The University of Missouri helped design and conduct a survey as well. The St. Louis Integrated Health Network provided consultation to the team related to community engagement and assisted in the delivery of follow-up services. This collaborative effort will prove invaluable in our ongoing response to this pandemic. The health and safety of all of our residents will always be the priority, and I thank all of the partners in this effort. Now I'd like to introduce to you Dr. Elvin Gang, a professor in the Division of Infectious Diseases at Washington University School of Medicine and a leader in this prevalence study. Dr. Gang.
Good morning. I'll just make a few brief comments to reiterate what Dr. Page has mentioned. The fact that only about 5% of residents had antibodies to COVID implies that the vast majority of people in the region are still susceptible to COVID-19. Because the proportion of people susceptible is related to how fast COVID can spread, it implies that the rate of spread could be very rapid. Because the proportion of people that are susceptible is also related to the absolute number or the ceiling, the 5% antibody also implies that the burden of disease from rapid spread could be very marked and quite high.
Dr. King, could you just pull the mic down a little bit? It's in there. Thank you.
Thanks. The approximate 1% earlier in the fall of persons with active COVID disease also implies that the number of people with active COVID and therefore the distance to epidemic threshold is relatively low, and therefore the spread that we're seeing this fall, the rapid spread, is consistent with that finding. One of the things that we learned from the survey is that the county testing efforts are probably detecting no more than a third of people with active COVID disease, and therefore if we apply those proportions to this fall, the number of persons with active COVID disease could be as many as 30,000 or possibly even higher. I think these results indicate that our region remains vulnerable and therefore that urgent public health action is necessary to keep the region safe. Thanks.
There's one question from St. Louis Public Radio asking when the survey took place. I don't know if that was mentioned specifically. Can you reiterate that?
Yeah, thanks for that question. The survey took place from approximately mid-August to mid-October.
All right. And then I have one question for you, Dr. Page. Unrelated. Can you talk about the signature petition online and the purpose of that?
Yeah, I think what we've seen over the past couple of months is relatively loud opposition to public health orders and broad but relatively quiet support for the orders that would keep us safe in our community and protect the health and welfare of St. Louis County residents. What has changed over the past few weeks, as some people in St. Louis County saw that there was an attempt to reverse or end those public health orders, they began to speak up more loudly and ask that we continue with our decisions that keep St. Louis County safe and protect our health and welfare. And I think you'll see a lot more activity among the people in St. Louis County who want us to be safe.
That's all I have.
Okay. Thank you.